Mike Moore Media.
I'm delighted to be talking with Lisa Ellington, Interim Public Health Administrator for Rockingham County. Hey, Lisa, it's good to have you on the phone. How you doing?
Good morning. Thank you. I'm doing well. I hope you all are.
We are, yes. And we have a lot to talk about on this podcast. But first, let's talk about the Lock Your Meds campaign. I did a story on that recently, thanks to you, with that information about lock boxes and cabinet locks. Tell us about that, please, Lisa.
Yes, our friends at Insight Human Services was able to make available to us some lock boxes and some locks that you can put on your cabinets or your refrigerators, to secure medicine cabinets, that sort of thing, or child safety related things. But also the lock boxes are for medication that you don't want people to get to, especially young children or those who may have a reason to divert them for some reason. We would like to make those items available to the public. And they're available in our governmental center. We have some at the receiving desk as you come in the door. So we would love for people to come over and get a lock box or get a lock to their cabinets or their refrigerator. And
these are absolutely free.
That's correct. That's correct.
Yeah, okay. How important is this to have something like this, Lisa?
I think it's very important because we don't want people to have access to medication that may be dangerous for them or they don't understand the consequence, especially when you have young people in the home, whether you have children of your own or grandchildren that are coming in the home. We just don't want them to have easy access to medications that could be harmful. And so it's very important that we can secure them in some way so that they can't be taken unknowingly, and because sometimes medication looks like candy, so kids don't always understand that. And so we really want to make sure that any kind of medication, especially opioid pain medication, that sort of thing, is secured. Because also the other concern is you have people that may be in and out of your home that may be looking for an opportunity. And sometimes that's the very first start of developing an opioid addiction. So we want to eliminate that possibility.
Mm-hmm. Definitely. And I believe it may have been in your news release, but I read it somewhere. I think that actually those prescription drugs and things like that kind of originate from a family member situation like that in your home. More times and often than from a stranger, someone on the street or something like that.
That is correct. That's correct.
Yeah.
And so that's the reason it's so important to be vigilant in securing your medications in your home, because you just never know. So it's better to be safe than otherwise sorry that someone had access to that and then developed a serious problem or became very ill as a result of it.
Sure. Lock boxes, they're free. Lock boxes, cabinet locks, now at the Rockingham County Governmental Center, right there in the main lobby as you go in. Okay. I read that every day more than 130 people in the United States die from opioid overdoses, including prescription pain medicines. That's a true number, isn't it?
Yes, I believe that's right.
Mm-hmm. Yeah. And that's a scary number, too. And people think, that's an opioid crisis you hear about on the news, and it's in the big cities. It's not here in Rockingham County, but that is not true, is it?
That's not true. That can happen anywhere, even in, our small communities in Rockingham County. It's so easy now to have access to that, especially if you have it in your home. But, oftentimes people who overdose, it's unintended. They weren't trying to die as a result. And so we want to stop that. We want to do everything that we can do to put some precautionary measures in place so that people don't have easy access to it, therefore they don't develop an addiction to it. And most of the time people who overdose and die, it was accidental. They didn't realize, and it's not just people that are addicts. Sometimes it's, young children. Sometimes it's older adults that forget they've already had their medicines and they take it again, not realizing. So there's lots of different scenarios, and we just need to be more vigilant in how we manage our medications at home and access to illicit medication.
Sure. Yeah. Okay. Do you have some numbers for us, Lisa, perhaps kind of bring it home here to Rockingham County about overdoses and things like that, or maybe ages of people that are involved?
Well, I don't have specific numbers to Rockingham County in front of me, but what I do have is some information from is from the office of the state medical examiner, the chief medical examiner. So I would direct people, if they have access to the internet, to go to ocme.data.request at dhhs.nc.gov. I know that's a lot, but they have all of the latest information in regard to overdose deaths. Oftentimes, people may die from a suspected overdose, but it's later confirmed, or they find another reason for the death through the state chief medical examiner's office. And so I would just direct people to that website. I do know that in December of 2023, as an example, there were 303 suspected overdose deaths, as opposed to December of 2022, 330. So that number is a little better, but there's still so much work to be done. And so we want to keep chipping away in any way that we can to get resources out there for early intervention or to get people into treatment and some recovery supports as well. So it's scary numbers. And we want to make sure that we're doing all that we can locally to get those numbers lower and lower and lower. I hope to have available some numbers that are uniquely Rockingham County numbers, but I don't have that available to me at this exact moment. But if anybody wants to reach out to me, they certainly can. I'm glad to provide whatever information I have available. And they can do that by email, and that's Ellington at co.rockingham.nc.us.
Okay. Ellington, Ellington, at co.rockingham.nc.us.
That's correct. And also, I'm available at my office number, 336-342-8258. So those are the two ways that you can reach me for additional information.
Great. 336-342-8258 to get to Lisa
That's
Ellington.
correct.
Yeah, interim public health administrator here in Rockingham County. You mentioned intervention. You mentioned recovery just a moment ago. Let's talk about your monthly recovery meeting.
Okay, I'd love to. It used to be called the Opioid Task Force. We voted as a group to change that to Rockingham County Recovers. We felt that was more applicable to the work that we're trying to do. And that meets the last Wednesday of every month. That could change a little bit at the holiday time, but for all intents and purposes throughout the year, we're going to meet the last Wednesday of every month at 5:30 p.m., and that's going to be at the Emergency Services Building in the EMS training room, and that's located at 150 Justice Center Drive, Reidsville.
Okay. I'm taking notes here so I can have that down. So that's a monthly meeting, Rockingham County Recovers. That's at Emergency Services Building, Justice Drive there in that complex, last Wednesday in the month at 5:30. Okay, got it.
That's correct.
Yeah. Well, what do you do in those meetings, Lisa? What's that all about?
This is a community work group. So you do have members that are concerned that are from our community. You also have government officials. You have department heads. You have treatment providers. It's just a host of different kind of folks that come together all in the interest of finding ways to work on the opioid crisis in Rockingham County. And we try to bring everyone up to date on what we are doing and what our hopes are, on the work that we can do within our reach within Rockingham County. And so we talk about the different programs that are going on, or those who have an interest in starting a program. And we encourage people to be thinking about what they'd like to see, what they, maybe sometimes people have some really interesting ideas that we haven't considered. And so we want to encourage that development.
Mm-hmm. Okay, very good. The opioid crisis, as we hear about it all the time, affects all ages, doesn't it?
It sure does.
And that's something that continues as we hear in the news all the time, and then right here at home in Rockingham County. I know you wanted to talk about, before time gets away, about some funding and how we can apply for that. So let's get into that right now, Lisa.
Yes, sir. We do have what's called a request for qualifications, or also known as an RFQ. And it's for community resource development or enhancement. And we are seeking people within the community. It could be a resource center, a community group, faith-based type organization, recreational facility, what have you. Anyone that's interested in developing a program that is tailored to recovery housing support, early intervention programming, or harm reduction related programs. And so all of that is funded through the opioid settlement funds, and we would love for people to put a proposal in, and we'd like for that to be done by the 27th. And they can go to the county's website at rockinghamcounty.nc.gov, and they should be able to find access to that. And we encourage people to apply for that funding if they have an idea that they want to push forward. And we'd love to take a look at it and see what we can do to get some of these programs funded and up and running.
Oh, that's good news. And that's covering, from what you've just said, Lisa, that covers a lot of different areas, lots of good opportunities there.
It does. And so I think that I just feel like people have ideas that they're trying to grow, and maybe they just don't have enough money to do it, or maybe they've got something going, but it's not, they haven't been able to sustain it in some way. And so we just would love to have a little pocket of money that we can put out there for them to get their program off and running, or to sustain their program a while longer, or just to help them cultivate a plan. And so I'm really interested in that, because I think that people in communities can do so much instead of, a larger, more government-based type thing or a treatment-based thing. This is earmarked for things that are community-related, and we want to encourage that.
Mm-hmm. Oh, that's great. Yeah, you're listening and you're helping with that funding. That's wonderful. Give us your contact information one more time as we wrap up here, Lisa.
Yes, sir. My email address is ellington@co.rockingham.nc.us, and my telephone number is 336-342-8258. Again, I'm the interim public health administrator, and my name is Lisa Ellington, and I'd love for you to reach out and talk to me.
Lisa, thank you for talking to me and sharing such important information on this podcast today. We all appreciate that and the work you're doing and your team there. And let's talk again soon if we can.
That sounds wonderful. Thank you so much, Mike. I appreciate you.
Thank you too, Lisa. Bye-bye.
Bye-bye.
All right, that's our monthly podcast with Rockingham County Government. Today with Lisa Ellington, Interim Public Health Administrator for Rockingham County. Again, let me give you her phone number, 336-342-8258. You can get more information at rockinghamcountync.gov.